Hello everyone, I am Dr. B. Sekhar Babu, consultant pulmonology at Sri Holistic Hospital KPHB. How to diagnose OSA or obstructive sleep apnea? It will be diagnosed based on the clinical symptoms and scoring systems. The next one is the sleep study. Clinical symptoms include excessive daytime sleepiness, snoring, apneic spells, etc. And the scoring systems include Stab Bank score, OSA 50 score, Epworth sleepiness score. And the final one, which is the gold standard test for diagnosing OSA, is sleep study or polysomnography, which can be done at home or in the hospital.